Mycophenolate, also known as Cellcept, is used alongside other medications to prevent your body from rejecting a transplanted organ, such as a kidney, liver, or heart. It falls under the category of immunosuppressant drugs and functions by weakening your body's immune system, thus aiding in the acceptance of the new organ. It is important to follow the prescribed dosage and take the medication at the recommended times for optimal effectiveness. Before you start using Cellcept Vial, make sure to read the medication guide provided by your pharmacist. This medication is given by injection into a vein, by a healthcare professional, usually twice daily, and injected slowly over at least 2 hours. When you are able to take medications by mouth, you may be switched to an oral form of this medication. The injection form of this medication should not be used for longer than 2 weeks unless directed by the doctor. It's important to avoid getting the prepared liquid on your skin or in your eyes, and if contact occurs, wash the affected area well with soap and water or rinse your eyes with plain water. Since this drug can be absorbed through the skin and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication. Use this medication regularly at the same times each day, and the dosage is based on your medical condition and response to treatment. Keep using this medication even if you feel well, and do not stop using it without first talking to your doctor. Some common side effects of Cellcept Vial include constipation, nausea, headache, diarrhea, vomiting, stomach upset, gas, dizziness, drowsiness, trouble sleeping, tremor, or redness/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as unusual tiredness, fast/irregular heartbeat, easy bleeding/bruising, swelling of the feet or ankles, joint pain/stiffness, or muscle pain. In some rare cases, this medication may increase the risk of a serious and possibly fatal brain infection called progressive multifocal leukoencephalopathy, PML. Seek medical help right away if you experience symptoms such as clumsiness, loss of coordination/balance, weakness, sudden change in your thinking, difficulty talking/walking, seizure, or vision changes. While very rare, a serious allergic reaction to this drug can occur. If you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. And as always, consult your healthcare provider for any concerns or questions about this medication. When taking Cellcept Vial, it's important to be aware that it may lower your ability to fight infections. This means you may be more susceptible to serious infections, or existing infections may worsen. If you experience any signs of infection, such as a persistent sore throat, fever, chills, cough, or changes in urination, it's crucial to inform your doctor immediately. Additionally, there is a rare possibility of developing cancer, such as lymphoma or skin cancer, while taking Cellcept Vial. It's important to protect your skin from the sun by avoiding prolonged sun exposure, tanning booths, and sun lamps. Using sunscreen and wearing protective clothing when outdoors can help reduce the risk. Contact your doctor if you notice any symptoms of cancer, such as swollen glands, sudden weight loss, night sweats, changes in moles, or unusual skin changes or growth. Lastly, if you are using Cellcept Vial, it's important to use reliable forms of birth control as it may harm an unborn baby. This applies to both men and women. For more information, consult the precautions section or talk to your doctor about the best time to take this medication and the daily dosage that is right for you. Before using Cellcept Vial, make sure to inform your doctor or pharmacist of any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's important to also disclose your medical history, especially if you have had cancer, liver or kidney disease, infections, stomach/intestinal problems, or rare genetic disorders. This medication may cause dizziness or drowsiness, and alcohol or marijuana can intensify these effects. It's important to avoid driving or operating machinery until you can do so safely and to limit alcohol consumption. Additionally, Cellcept Vial may increase your risk of infections or worsen current infections, so it's important to stay away from individuals with contagious illnesses and to discuss any exposure to infections with your doctor. Before receiving any immunizations/vaccinations, inform your healthcare professional that you are using Cellcept Vial. It's also important to exercise caution with sharp objects and activities that could result in injury, and to inform your doctor or dentist of all the products you use before undergoing surgery. If you are using Cellcept Vial, it's important not to donate blood or sperm while using the medication and for a specified period after discontinuing it. Women who are pregnant or may become pregnant should not handle this medication due to the potential harm it may cause to an unborn baby. It's important to discuss reliable forms of birth control with your doctor if you are a woman using this medication, and both men and women should consult a doctor immediately if pregnancy occurs while using Cellcept Vial. Breastfeeding is not recommended while using this medication due to the potential risk to the infant, so it's important to consult your doctor before breastfeeding. When taking Cellcept Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Some products that may interact with Cellcept Vial include cholestyramine, cholestyramine, and other drugs that weaken the immune system or increase the risk of infection. It's also important to note that this medication may decrease the effectiveness of hormonal birth control such as pills, patch, or ring, which could lead to an increased risk of pregnancy. If you are using hormonal birth control, it's recommended to use an additional non-hormonal form of birth control while taking Cellcept Vial. It's important to discuss your options with your doctor or pharmacist and to also inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. If someone has taken too much Cellcept Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. During your treatment with Cellcept Vial, it's important to undergo regular lab and medical tests, including blood counts, drug levels, kidney function, and pregnancy tests. Make sure to attend all scheduled medical and lab appointments, and consult your doctor for more details. It's also recommended to attend a transplant education class or support group to learn about recognizing the signs and symptoms of organ rejection. If you experience any of these symptoms, be sure to inform your doctor immediately. If you forget to take a dose of Cellcept Vial, it's important to talk to your doctor or pharmacist to set up a new dosing schedule. It's crucial to take this medication as prescribed to ensure its effectiveness. This medication is administered in a medical setting and is not intended for home storage. It is used to prevent organ rejection in people who have received a kidney, liver, or heart transplant. The dosage and timing of administration will be determined by your healthcare provider based on your individual needs. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.